Welcome back to the weekend show. You're now watching the lifestyle segment. The topic of discussion today is medical negligence. Medical negligence is an act of omission by a medical professional that deviates from the accepted and standard care of practice. To discuss these issues today, we have
with us in the studio Dr. Chira Obiora, who is a family medicine consultant and also a member of the Nigerian Medical Association. Welcome to the weekend show.
Welcome.
We also have with us a consultant neurosurgeon, Dr. Douglas Emeka Okor. As much as he doesn't like being called doctor, you're a doctor. And so welcome to the weekend show.
Thank you very much, Andy, and thank you, Osasu, for having us.
You're most welcome. So I'll start with you, Dr. Obiora. What qualifies as medical negligence?
Thank you, Osasu. Well, as a medical practitioner, a doctor in particular, if you are supposed to handle a patient, if you owe a patient a duty of care and you couldn't deliver on that duty of care, or you handle it in breach, that is what qualifies as medical negligence. So, number one, you must owe that patient a duty of care. Then two, you must owe that patient a duty of care. Two, then you are found to be derelict in your duty. Then three, that duty, that dereliction causes damage to an individual. And then four, it could cause harm and the rest of them. And that is what you could qualify as a medical negligence. And that is a body of law that you can sue an individual for malpractice.
Okay, Douglas, I've seen a lot of doctors talk about how, oh, we are humans also. Sometimes we get tired, sometimes we work for 24 hours straight, and some of these things happen. But you have situations where Nigerians are diagnosed for something, sometimes in Nigeria. A good example, I have a sister who was diagnosed for a certain situation in Nigeria and was told she needed surgery. And so we were privileged enough to send her out of the country. And when we realized that all she needed were just different prescription, and so she didn't have to do that surgery. What really is the problem?
I think basically, Andy, you look at two things. You look at context and you look at capacity. Okay, so I think those are two very important things. So whenever you talk about medical negligence and malpractice and stuff like that, you need to look at the environment that you are in and look at capacity. So in capacity in terms of the human resource for health, the human beings who are actually delivering this health care, and look at the environment in which they're delivering that care. The key issues of medical negligence, you would look from those perspectives. So, for example, the place where your sister went to actually have that diagnosis, did they have the capacity to actually make that diagnosis in the first place? Did they have the hardware? Did they have the kind of instrumentation that they need or anything they need to actually provide that kind of care or to make that diagnosis? So it has to be looked at in context. So, and that's why it's really, really important that you look at things like actually training of staff, actually not just training in terms of the technical skills, but the soft skills and what I call the non-technical skills. Because if a facility, for example, cannot provide a diagnosis for your sister, they should be able to communicate that and say, hey, we don't have the capacity to actually make this sort of diagnosis. We might think it's this, or this, but we really don't know.
So we know now the options that are open to individuals, patients who have experienced some sort of medical negligence. We're going to open up the phone lines after this short break so we can hear from Nigerians all across the country about their experiences with this issue. We'll take a short break right now. When we return, we'll hear from you. Welcome back. The number to call to join this conversation is 080 333, that's 3333 4770. That's 080 3333 4770. Call in and share your thoughts with us. Dr. Obiora, how does one go about seeking compensation for medical negligence?
Thanks, Sas. First of all, let's take this negligence in a wider perspective. You have gross negligence, which is due to the problem of emanating from the doctor or the healthcare professional primarily. And then in that form, the patient sues the healthcare professional or the institution, which I will come into it, or the hospital. Then you have what we call contributory negligence, where the patient also contributed, in short, in a higher percentage to the problem. So in that form, the patient might not get everything he wanted. At times, the patient will not even get anything at all. So, and we also see how it goes. And then you have a third type, which is called comparative negligence. In comparative negligence, the patient contributed, but not the primary cause. For example, you see somebody, maybe the patient, let me just use a car accident scenario. Patient was the person was driving, and then he runs through the green light, which is normal, and jams into a car that runs through a red light, runs forth of a red light, and then got injured. So you see that, but the person wasn't wearing seatbelt. Yes, he also contributed partly, but not to the extent that he was at fault. So the person also have some claims to make. Then we have a mixed component of that. So for one to go about suing this, we have categories. First of all, you can report this case to Medical and Dental Council of Nigeria, which is a body made available by the state. You can also go through Consumer Protection Council, which will help to also activate your case. Or the person or the patient or the injured one or the plaintiff, whatever we want to call the person, can also kickstart a primary criminal proceeding, which we have laws in the country that.
Sorry, let me just interject. We have a caller. Your name and where are you calling from, please?
I'm from Yanokwaja.
Sorry?
Yanokwaja.
Okay, what's your name?
Onyinye.
Okay, hi Onyinye. What's your contribution to the discussion?
I think I had that experience of medical negligence once.
Okay. What happened?
I was to deliver my baby. So initially when I got to the hospital, I was checked on and I was told that my baby is still very far.
Okay.
So the doctor checked on me and then asked me to go home. So I insisted on staying because my first 3 children, I had them with induction. I was induced. I don't used to feel labor before going to the hospital.
Okay. Then what happened?
So finally, as God may have it now, I now saw traces of blood right there in the hospital.
Wow.
So I was now admitted into the labor room. But it was in the night, and I had only one nurse on duty and a doctor, and many women in labor. So they were so tired, frustrated, and all that. So when I told the nurse that my experience in time passed, because when I had my second baby that weighed 5 kg, I was given a fondant pressure. So I now explained to her that most times if I want to deliver, that maybe my baby used to go back. Except I'm being supported. The baby, if I open my leg, they will go back. If I close my leg, the force will be coming. So I was explaining to the nurse on duty now. She was like, stop telling me that story, Jerry. Wow. So I was neglected. And when the doctor even finally came, he said, this woman said, let's see what is wrong with her. He checked on me. I said, I'm feeling the pressure to push. But when he asked me to push on my own, I can't push except the force comes by itself. So
wow.
So I was now left alone. I started pushing. They were leaning there on the wall. I have to push the first time, push the second time, the third time. I think the fourth time, they now saw the baby head. That was when he just, reluctantly now approached me and then assisted me. Even when I had the baby, I had tear. So I was supposed to be stitched up. And there's this particular injection they used to give. He forgot. He just wanted to start stitching me. I was like,
wow.
Inject me now before anything.
Wow.
When he did the first one, and then he was stitching. He was doing the stitching, and then it got to a stage I was feeling severe pain again. I told him, inject me again. He was like, are you the one that is going to teach me my job?
My
So
God, Onyinye, I'm so sorry. I'm so sorry to hear. I'm so sorry to hear about this situation. It's my hope that from discussions like this, we can shine light on the situation that's going on across the country, and the doctors here in the studio can prefer some solution to this. I'm so sorry, and thank you so much for calling in.
All right.
Thank you so much. Thank you. Doc, how do you respond to that?
Onye's story brings up exactly what I was talking about just now. Context and capacity. Okay? Context. she's going into a facility where there's only one doctor and one nurse to look after how many women? The doctor and the nurse, they are very, very human, okay? If there's excess work, they've not rested and stuff like that, the safety of the patients will definitely be compromised. Okay, so context is very, very important, and capacity is important as well. You could see that this was a facility that did not have the capacity to actually manage that number of women who have these issues. They are giving birth. Just one doctor and one nurse. The nurse will definitely be frustrated. The nurse will be tired. The nurse will not give her best. And definitely the safety of those patients will be compromised. And just to let the viewers know and everybody know that when you talk about medical negligence, you're not just talking about negligence of the doctor. I know Dr. Obiora was talking about the Medical and Dental Council as one of the places where you can actually report to or try and sort out yourself in terms of if you have any grievances in terms of the care you provided. Nurses, medical lab scientists, physiotherapists, any healthcare professional at all, you know, can be negligent. So medical negligence covers everybody. So when you're talking about reporting, trying to get restitution or trying to get any sort of compensation or anything like that, there are different bodies that regulate different healthcare professionals. So the example that Dr. Obiora gave in terms of the Medical and Dental Council is for dentists and for doctors. Of course, you have the Pharmacy Council of Nigeria, you have the Midwives, Nurses and Midwives Council of Nigeria and all that. Okay, so context is very, very important. We know, Osasu and Andy, that we are struggling when it comes to healthcare in Nigeria. And we've been struggling for a very, very, very long time. There are fundamental issues that we have in our healthcare system.
But Douglas, interestingly, and we spoke about this recently, the immediate past Minister of Health, this type of situations came up, and he said we have a surplus of doctors in Nigeria, and so none of them have to be consultants. And so that's number one. But also, when you talk about context, how many average Nigerians know that this hospital has only one doctor and one nurse? How many Nigerians can afford, within the case of context, going from one hospital to another to check? I had a situation from someone who responded to us on Twitter saying about 2 weeks ago they lost a sister who was pregnant, and this was after they had gone to one hospital, then to National Hospital, and then to the third hospital, had to pay 500,000 naira before she was attended to, and she still lost her life. Most people don't have the money. They don't understand how the system within the hospitals work. So what, Dr. Obiora, what is NMA doing about this?
Thank you, Andy and Osas. I think, first of all, the issue of having enough doctors, I don't think the minister is correct.
That was Dr. Ngige. He's actually the minister for labor.
He's a doctor, unfortunately, and I don't think he is correct, or he has lost his statistics. Normally, if you take about the number that we have now in this country, I don't think we have up to
40,000.
Roughly 40 to 40,000 doctors.
For almost 2 million people, for almost 200 million people.
For 200 million Nigerians. And the World Health advocates that you have, if you're a consultant, one consultant to 6 patients. So I don't know how many consultants are within this 40,000 doctors in a whole. Then if you are not a consultant, you are general first degree MBBS holder, you are supposed to one patient to at least 10 to say 20 patients, one doctor to 20 patients. So, and you have that, and you divide 40,000 by 200 million Nigerians, and then you see that we are far below what we're supposed to get in terms of World Health approved or standard. Now, for NMA, we are interested in preventing this problem because we know that the problem is enormous and it's on the increase. So what we are doing at the angle of NMA is to prevent it. We've started by making sure that any doctor that wants to practice must have a kind of a seal. Then when you write anything, you put your seal, and then we know that this thing is coming from you. And if we see any telltale sign of somebody that could lead to negligence or malpractice or anything that we want to call it, then we pick that at the board. Then the second, we also at NMA level, for you to do a practice, for you to practice in a year, you should obtain an annual practicing license. And for you to get that annual practicing license, you must have what we call CME, what we call continuous medical education, and NMA certified continuous medical education. And you have to produce minimum of 20 points or 20 credit units, as you might want to interpret it. So for you to get that, you must have gone through some retrainings. for you to register to practice in a year. And this is done continuously. Every year you want to practice, you do that. And MDCN is mandated that for you to give anybody any practicing license, that person must produce CME points.
But going past that, sorry for cutting you short, what about the high cost to the patients even before they are even treated or looked at in the hospital?
No, okay, I will come to that high point. Then still in NMA stuff, we've set up what we call anti-quackery committee. The anti-quackery committee, of which I share in FCT, is what we are going about is making sure that we have doctors that are doctors, because we have a lot of fake doctors too. And then even within the doctors that have the certificate of doctors, are they practicing what they are supposed to practice?
Most definitely. Doc, I'm going to interject just a bit. We have a caller. Your name and where are you calling from?
Hello?
Yes, your name and where are you calling from, please?
Okay, I'm calling from Caro. My name is Michael Douglas.
Hello, Michael Douglas. Do you have an experience to share?
Yes, I have an experience to share.
Go ahead.
Yes, I do.
And can you please turn down
I
your
have.
TV set because we can hear ourselves?
Okay,
Thank
can
you.
you hear me?
Yes, I can hear you clearly. Go ahead. Share your experience.
Okay, yeah. Fortunately, Dr. Douglas, that's my namesake.
Nice. Thumbs up.
I've had we're talking about this medical negligence. I'll share one or two incidents with you. There's a case where a little girl was, she had appendicitis and she was operated upon. And a doctor, during the stitching, he stitched her and then forgot a small scissors on her. And then that thing, after it got healed, it took over a while, about 2 months, she started feeling pains. Not known to her that there was a scissors in her. And that thing led to her death.
Wow.
You know, so there are many cases like that. And also many other cases like where you go to the hospital. Yeah, just like when you started. A doctor there said, you need to, there's a way you approach a patient. I used to have a doctor friend, he's of blessed memory now, Dr. Ibrahim. If he attends to a patient, I think the patient gets healed before even taking the injection or drugs, because of the manner and the way he approached the patient and make the person feel that is above the illness. You know, but some doctors will approach you as if you are not human. They attend to you as if you're not human. They approach you with, yes, every patient has the right to know the status of their health. But like I speak to you on this aspect, I took my wife to the hospital. Or my wife went to the hospital, she had a surgery, and an x-ray. So a doctor read and interpreted the x-ray. Without asking her who came with her to the hospital, just reading about the x-ray, a doctor, you call your patient to your office and then try to explain the thing so that you won't just kill the patient at the instance of just hearing the cause of illness. You know, he just said, this is a matter of sarcoma. Oh, give her birth, we'll amputate her leg. You just don't kill people like that.
Without explaining. Mr. Douglas, thank you so much for calling in.
Give her birth, this amputation, this sarcoma, is amputation, you know.
We apologize for that, and we're so sorry for cutting you short, but thank you so much for calling in to share your experience. Dr. Douglas, you had your namesake. You had the level of medical negligence. I want you to also clarify the last statement you made. Are you blaming the lack of human resources in these hospitals as the reason for medical negligence? Who then does the patient hold responsible for this situation that we've heard today from callers?
If you remember, Osasu, the last time I came on this show, one of the things I talked about, we have fundamental issues with leadership and management generally in this country, and specifically with healthcare. Okay, until we start moving from point A to point B with developing our leadership in this country, especially with these very critical issues like healthcare, we will be struggling for a very, very long time. Okay, it's very fun, isn't it? You have nurses, physiotherapists, doctors who are looking for jobs in Nigeria. Okay, and you have definitely less than 50,000 doctors, and of those 50,000 doctors, you have doctors still looking for jobs. In the UK, where I'm trained, okay, with a population of 65 million people, they have almost about 270,000 doctors. They have 80,000 consultants, almost twice the number of the total number of doctors that we have in Nigeria. We are not taking healthcare serious in Nigeria. And that, what I'm saying is that leadership is like parents to children. If the leadership doesn't take healthcare serious, it trickles all the way down. Nobody takes it serious as well. And it's a fundamental and serious issue.
But amongst those less than 50,000 doctors, those ones are still not doing their jobs properly. You just heard them about someone forgetting medical utensils inside a person's stomach. A friend, someone who had messaged. Hold on one second. Someone who had messaged the show said that her friend died due to medical negligence, and the doctors tried to cover up the situation. Yeah. So even amongst these doctors, there's still a lack of training. There's still a lack of professionalism.
Absolutely, because the platforms to actually enshrine these things and make them happen are not there. When you talk about robust accountability mechanisms, performance management, do you understand? Issues like clinical governance and stuff, those things are not there. Risk stratification, do you understand? Risk management, those things are not there.
But isn't that why we have NMA and the medical and dental?
NMA is Nigerian Medical Association, a body of doctors. The Medical and Dental Council of Nigeria is a regulatory body. The NMA is a body, it's like an association. It's like the Nigerian Bar Association. It's just an association of doctors.
But they hold them, Nigerian Bar Association, they hold lawyers accountable.
Let me
with dental.
Exactly.
Okay, let's hear Dr.
Yes, let me come in here. Number one, at least I love this show because one, it's a way of sensitizing the public for them to know their rights and their left. I don't think that you have any excuse by any health professional, doctor inclusive, not to manage your patient. Do it like if you come to my practice in Babalada University of Abuja, I will tell you, I take my time, I see my patient. As a family physician, I'm trained to take my time and do what I'm supposed to do. Now, as a doctor, if you practice and you forgot scissors, forgot this, you are supposed to do this, and there is one form of negligence or the other, then you are culpable, you are liable. That is number one. Then two, at NMA level, we are doing whatever we could to make sure that we prevent this. And then when this thing is exposed, we are also having problem. Like I can talk from my own perspective, angle where I chair anti-quackery committee. You find out that we don't have any database of hospitals from FMC. We don't have our doctors, even the doctors that are in Nigeria. You cannot, as a patient, go to a hospital and pop up and say, you are not sure of this doctor. Let me even be sure that this person is a doctor. You don't have anywhere for you to get that. And we are advocating on daily basis. Just have taken Galaxy backbone to MDC and to see how can we get database that patient you come, you say, okay, there's a problem. Let me be sure that this person is a doctor. You say, what's your name again? You see the picture and the rest of them. That is what you do in the West.
So it seems the regulatory bodies have failed.
They are weak.
And that is where
extremely weak.
Exactly. So they have failed completely, and they're failing the Nigerian people. So that's where change really needs to start. Because we're complaining about the low number of doctors, but the quality of doctors we have are terrible.
Of course, it's
so
questionable.
Even if we have more doctors, even if we have matched the UK and have 200 and something thousand doctors, the reality is that as long as they're not still able to perfect,
it's about creating those standards and enforcing them and having the capacity to actually enforce them.
Could you imagine that? Could you imagine that a Ministry of Health that regulates, that manages all the health issues in the country, could have a fake doctor within the midst, and the person has worked for 15 years? And it takes an effort of one of us in NMA to pick and say, oh, this person, during the Ebola issue, and say, this person is not talking like a doctor. Then what do? We started investigating and found out that he's a fake doctor. So in that case, the institution is culpable.
I think
we have a lot of issues.
For me, when I talk most of the time about issues like this, you understand, the first thing I like to do with actually informing the public is what the realities are. Okay, if you understand what the realities are, then when you're actually trying to seek redress or trying to improve things, you know where you're coming from. The healthcare system in Nigeria is weak. It's extremely weak. And to actually start the process of actually sorting these things out, because it's a journey, it will take some time. The leadership of this country must take healthcare seriously. I don't know how else to actually put this forward. They must take healthcare seriously. Because if you're waiting for the doctor who is in the post, do you understand, somewhere, and he's the one looking after like 100 patients and stuff like that, to deliver his best to his patients, that is the biggest joke of the century. That's what I'm trying to say.
I think it's also quite unfortunate that with all these problems, and it's quite saddening. I can see the look on your face.
I'm so
and the expression from even doctors that we are in a country where the best of the best are leaving the country.
Absolutely.
Most of them are going to the same UK to Canada.
Yes,
Absolutely.
yeah. Sorry, we have a call. Your name and where are you calling from, please? This is our last call. We have to go. Your name and where are you calling from?
So my name is Samson from Yanya.
Okay, Samson, can you quickly summarize your experience with us?
Yes, please. This issue of negligence is a very critical issue, especially in the medical field. I have an experience with a doctor in a private hospital. My daughter of 7 years old complained of stomach ache, and we took her there. He's our doctor, and we took her there. He diagnosed and scanned and told us that he has appendix, and it requires emergency operation. So while we are still trying, and the money demanded was so high, and if to say the money was actually high, we have quickly rushed into it. But because while we are still sourcing for money, somebody advised us, why can't we just take this child to the government hospital? We actually went to Yanya Hospital the second day, and eventually she was diagnosed that he has a chronic typhoid, and she was diagnosed, treated. Until now, there was nothing like that again. So it could have been a serious risk of this daughter's life, this girl's life, that you have gone to operation at that stage, and something else could have happened. So
Wow.
I think the medical practitioners should be very careful about this, because negligence is everywhere, but when it has to involve life, it's a very serious.
Most definitely. Thank you, Samson, for calling in and sharing your thoughts. Doc, both of you, I'll give you an opportunity to respond to that in 30 seconds. We don't have any time. I'll start with you.
Okay. This issue that he raised
Yes,
now,
and your final words.
is rampant, and some of them could do this maybe because of the financial gain. They will see not just once you complain of headache, somebody will go and open you up.
So doctors misdiagnose people just so they can actually...
Financial gain, and
Wow.
also it might also not be a doctor. But now, let's be sure that that person is a doctor. That my final word is the issue we are advocating at NMA level for National Health Insurance Scheme to get to a full national, have a universal coverage. Right now we have 4% coverage, and that could not. Now that is what translates to the high cost of medical care that you have in Nigeria. So for us at NMA level, we believe that government can do it. They should actually send programs for us to mop up people in the public and see how we can have a universal coverage. And then we keep pushing. NMA has anti-quackery committee, department or desk, and then we'll have hotlines and we'll have this. So we could start from there by reporting any suspicious move. And then patients also should not have a lot of delays. Most of the times they are sick, they go to chemists, they go to pharmacy, they go to lab. After that, they go to their pastors, they go to this. So they have a lot of delays. By the time they are coming to a doctor, that doctor does not have really option to do magic. So, and we know we are dealing with life. They should know that any mistake from us or from anybody, that person could die or have a permanent injury. So mine is public should be aware, and then know that doctors are taking it serious, especially at NMA level, that when they see any suspicious move, they should report to NMA.
Thank you, Dr. Obiora. Dr.
Okay, so key question you asked me earlier on was, what is NMA doing? One of the key things that NMA is doing this year, towards the end of this year, is that they are organizing what we call a National Health Summit. And guess what the theme of that summit is? It is patient-centered care. So they're actually taking it seriously. Now, on a final note, where do I leave everybody? How do we actually build a healthcare system where you can have accountability, performance management, okay, clinical governance, you understand, proper regulation, robust regulation and stuff like that. That's where we need to be going, and we need the leadership and management of any healthcare, whatever, in this country to be strong, and we need human beings in Nigeria to start pushing for that. Thank you very much.
Thank you, Dr. Douglas and Dr.
Thank you,
Obiora.
Osas.
You can still continue this conversation on our social media handles at Weekend Show NG on Twitter, Instagram, and Facebook. Share your comments with us, and we'll be able to read them before the end of this program. We'll take a short break right now. When we return, more on the Weekend Show.